Hello, it's really lovely to be back with you all again today virtually. My name is Kathleen Turner, and I'm the dietitian here in the Cardiac Rehab program at the Heart Institute. And today we're talking about the Nutrition 201, which is all kinds of frequently asked questions. So these are the things that I hear from you folks as patients all the time on the track. So I thought I would get some of these questions answered for you. So let's dive in. So, is sea salt better than table salt? This is a question I get asked probably every day almost. People always want to know if they can use sea salt, and the short answer is no. So, sea salt, table salt, kosher salt, they all have the same amount of sodium in them, and this sodium is what you want to be cautious of. So, too much sodium can increase your risk of developing high blood pressure, and then high blood pressure is a risk factor for heart disease and stroke. So it doesn't matter what kind of salt you use, they're all the same. So pick the one that you like best and use less of it. And just remember to keep in mind that for most of us, the sodium that we get, most of it is actually in processed and prepared foods. So the less you can eat processed and prepared foods, the more you can cook at home, the better. And of course, you want to use less salt, regardless of the type of salt that you choose. All right. Moving on to the butter versus margarine question. And this might be, it's a toss-up between whether butter versus margarine or sea salt versus table salt is the most asked question. But before I dive into answering it, I want to talk a little bit about the different types of fats that you find in food. And the next few frequently asked questions are kind of related to that. So think of it as background knowledge. So in the foods that you eat, there's three main types of fats. There's saturated fat, trans fat, and unsaturated fat. And they all have slightly different effects on your heart health. The trans fats you want to limit as much as you can, but for the most part, you find those trans fats in processed and prepared foods. And there is a ban in Canada on trans fats, so it's not a huge issue anymore. Saturated fats are the animal-based fats. So you find these in animal products. And these are the fats that are not so good for your heart health. They're going to increase your LDL cholesterol, that lousy cholesterol. And then unsaturated fats are the good heart healthy fats. And you find those mostly in plant-based foods. So one thing I want to mention is that one of the things that's happening in nutrition right now is that we're really shifting away from talking about nutrients to talking about food. So even though I'm going to talk a little bit about saturated and trans fats, I'm mostly going to talk about food because you don't eat a nutrient, you eat a food. So after that long preamble, coming back to the question about whether or not butter is better than margarine, it probably doesn't matter. So butter is mostly a saturated fat. It's that animal-based fat, so not great for your heart. Margarine is mostly an unsaturated fat, which is good for your heart. And usually they add a little bit of saturated fat like palm oil to make it a solid at room temperature. Whether you pick butter or margarine probably doesn't matter that much. But whichever one you pick, you want to use less of it. Your main cooking oils at home should be liquid plant-based fat. So it should be things like olive oil, canola oil, avocado oil, sesame oil. There's so many different kinds out there. Find the one you like and use that one, or use different ones for different recipes. So that was a long-winded answer to that question, but we're going to move on to the next one, which is about coconut oil. And this coconut oil is so popular. Everyone always wants to use coconut oil. And you remember I said that unsaturated fats are usually plant-based. This is the exception to the rule. So coconut oil and palm oil are the only two plant-based fats that are mostly saturated. So we don't have a lot of research on how coconut oil affects your heart health, but the little bit that we do have shows that when people use it as their main cooking oil at home, it increases LDL, which makes sense because it's a saturated fat. So you don't have to avoid using coconut oil completely, but don't make it your main fat at home. You want to come back to these liquid plant-based fats that you have available that you can use and try out different ones. So tied back into fat is the question about red meat. And this is another question that I get asked a lot is how much red meat should I eat? And red meat includes beef, pork, lamb, venison, moose, any land mammal fits into this category. what we know is that people who eat a lot of red meat, they have a slightly increased risk of developing cardiovascular disease. But what does that mean for you? It means you want to have less red meat. It doesn't mean you have to eliminate it altogether or become a vegetarian, but you want to have less of it. So kind of once or twice a week, and then choose other foods like chicken, fish, plant-based proteins like beans and lentils and tofu. That's a great way to replace some of that red meat in what you're eating. And if you're sort of struggling with how to do that, good options are if you make a chili, for example, use a lot of beans in that chili. Or if you make a spaghetti sauce with ground beef, use half ground beef, half lentils in your spaghetti sauce. If you use a lot of ground beef at home, sometimes use ground turkey. That's a really great alternative. So you don't have to stop eating red meat, but you want to think about having it less often. So what about milk? People are always asking me, should I drink milk? Is this good for my heart health? And milk is very safe. If you are someone who enjoys drinking milk, you can absolutely continue to do so. Generally speaking, you want to drink 1% or 2% milk for your heart health, but you don't have to eliminate it. If you hate milk, though, you don't have to start drinking it. It's really, if it's something you're already enjoying, try to pick that 1% or 2% milk. If you're eating cheese, you want to be a little bit mindful of cheese because cheese is really high in that saturated fat that I mentioned at the beginning. So it doesn't mean you have to stop eating cheese, but try to be mindful of how much you're eating and use less of it. People also ask me about milk alternatives. So things like soy milk or cashew milk or oat milk. Those are all alternatives to milk. They're not necessarily better or worse. They're just different. Soy milk tends to be the closest in terms of how much protein is in there compared to milk. Something like almond milk is very low in protein, but they're all options, and a lot of it will come down to your taste preference. All right, what about nuts? So this is also a question that people ask me is, what is the best nut, or am I allowed to eat nuts? Are they good for me? They are good for you. So you can continue to include nuts, and there is no best nut. So find the nuts you like and eat them. If you like peanuts, eat peanuts. If you like almonds, eat almonds. If you like cashews, eat cashews. There's no problem with eating nuts. They're full of those plant-based fats, the unsaturated fats that are very good for your heart health, and they also have some protein in them. A lot of people tell me they don't like unsalted nuts, which are your best bet. You're better to buy unsalted. So if that's something you struggle with, buy a package of salted and a package of unsalted and then mix them together. And that way you reduce the amount of salt you're eating or sodium that you're eating. And tied into that is peanut butter. People always want to know if they're allowed to eat peanut butter, and absolutely you can eat peanut butter. It's great if you could try a natural peanut butter, so where it's just the nuts crushed up. There's no added sodium, there's no added sugar in that, but it's a great sort of place to try to get to. But there's other nut butters as well. So you might even try something like cashew butter or almond butter. There's so many different nut butters that you can include, and they make a great snack. So you could put it on toast, you could have it on peanut or on a banana or an apple. Great option for you. Okay, we're shifting gears a little bit. So I kind of covered the questions that often come up around foods that have fats in them. And now we're going to talk a bit about vegetables and fruit, and then shift into talking a little bit about carbohydrates and gluten. So before we get there, the thing I hear most often about vegetables and fruit is there a best vegetable or fruit? People always want to eat the best vegetable or fruit. There is no best vegetable or fruit. It's the one that you like and that you will eat. Ideally, you want to have a variety of different vegetables and fruit. So, you get different nutrients from different vegetables and fruit. However, if you only like peas and carrots, it's better to eat peas and carrots than nothing at all. So there's no best. And oftentimes a vegetable or fruit will become trendy, and we'll hear about this superfruit or this super vegetable. It's a bit of a myth. There's no super fruits or super vegetables. Just try to eat vegetables and fruit regardless of which ones they are. What about gluten? I am certain that most of you know somebody who's following a gluten-free diet. So gluten is the protein that you find in wheat and barley and rye. And for people who have celiac disease, they have to eliminate gluten. It's very harmful for their health. But lots of other people might not have celiac disease, but they might feel they're gluten intolerant or they're sensitive to gluten. one of the challenges is we don't have a lot of research to be able to diagnose gluten insensitivity or gluten intolerance. However, that being said, if you're someone who feels kind of crummy when you eat gluten, you could certainly avoid it if you wanted to, but there is no health benefit in avoiding gluten, and there's no harmful effects of eating gluten. So if you like some of those foods that gluten comes in, like, wheat or barley or rye, you can continue to eat those. What about low carb diets? This is tied in also to the gluten-free. So the gluten-free diet is kind of a version of the low carbohydrate diets. And these have been popular for probably 20 years under various different names. There isn't any evidence that going low carbohydrate will have any benefit to your heart health or any negative effect to your heart health. And carbohydrates include foods like breads, cereals, pastas, bulgur, quinoa, fruit, dairy has some carbohydrates in it. So you certainly do not need to avoid carbohydrates. When you choose your carbohydrates, though, you want to try and pick the ones that have a lot of fiber in them or that are whole grains. So that's things like brown rice or wild rice. You might try quinoa or bulgur or barley or farro. There's so many different grains out there, but you can also stick with brown and wild rice and whole grain pastas and breads with whole grain flours in it. Those are also options that you have available to you. So short answer is you do not have to follow a low carb diet. You can continue to include them, but you want to try and pick the whole grain ones instead of those refined ones. Now we're totally shifting gears for the next two slides. We're going to talk a little bit about beverages, so things that you drink, and coffee or tea is a big one. And I get it. For those of you who are coffee or tea drinkers, you probably don't want to imagine life without it. There is no reason to avoid coffee or tea. So the reason there are some limits, though, or recommended limits, are because of the caffeine that's found in coffee or tea. So the recommendation is not more than 400 milligrams of caffeine per day. So, that's good to know. But one of the things that's kind of challenging about coffee and tea is we don't always prepare them in the same way. So they have varying different amounts of caffeine. But generally speaking, if for coffee, you can have up to 4 cups of coffee a day. And that's an actual cup, like not 4 extra larges from your local coffee shop. It's an actual 8 ounce or a 250 ml cup. So 4 of those. And for tea, you could probably have a little bit more than that. So if you think about how you make your tea, you could steep it for 10 minutes or steep it for 30 seconds, which is going to change how much caffeine is in there. All right, and this seemed pretty timely. It's funny, this is a question about whether or not foods can boost your immune system. And I don't think many people had ever asked me that prior to COVID, but I certainly hear about it now. There's no one food that's going to boost your immune system. So there's nothing that you can eat that will help to prevent you from getting any kind of infectious disease. However, eating well overall will have beneficial effects on your health, which is always a good thing. So you still want to make sure you're following all those guidelines that we talked about in the Nutrition 101, cooking at home and eating more vegetables and fruit and less red meat. And if you're doing those kinds of things, it's going to have a positive effect on your health, even if it doesn't necessarily boost your immune system. So the last question that I want to leave you with is this idea that, what is the best diet? So what's the best way of eating? And the answer is there is no best diet and there is no best way of eating. A lot of nutrition is finding out what's going to work for you and what are the patterns of eating that you can fit into your life that you can live with. We know that diets don't work over the long term. It's more important to think about making small changes that you can live with and that you like doing long term. So if you're thinking about, what is that best pattern of eating or diet, go back to that top 10 tips that I know you've seen and we've talked about in the Nutrition 101. And if you're doing those things, you're cooking at home, you're eating at the table, you're eating lots of vegetables and fruit, less red meat, more whole grains, more plant-based proteins and fish. If you're doing all those things, most of the time you're eating well. And that pattern of eating is going to look a little bit different for everybody. And that's okay. It's about finding the pattern of eating that works for you. So before I wrap up, I just want to remind you that the big overarching rule in nutrition to keep in mind is that 80-20 rule. So 80% of the time you want to think about eating well. 20% of the time life happens. You might go out for dinner or have a treat. Those things are very normal. And don't forget that food should be fun. It should taste good. There's so many ways to experiment with food and still make good, healthy food choices. So thank you so much for joining me today. It's been such a pleasure to meet you all virtually. And again, if you're looking for more information, visit our website.